All right, so today we have a special guest, Mark White. Mark White and I go back a long time ago. I watched him taking a shockwave device, bringing it into the market, creating an amazing procedure that helped thousands of lives, build a successful revenue for his own medical practice, and then took all of that, packaged it, and gave it to other physicians so they can experience success for themselves, not only for the patients, but also increasing revenue in the practice. Nowadays, we want to learn from what is Mark doing right now with the shockwave specifically. I've heard that the latest innovations he's working with will help not only medical practices specializing in sexual health, but also medical practices specializing in other verticals, increase their revenue, increase their patient base, also increase retention for the patients. So with that in mind, Mark, can you give me a little bit of understanding of what is Omniwave?
So Omniwave is the next generation of regenerative medicine. It's like when you think of regenerative therapy, you think of stem cells or PRP, but this is shockwave, which is non-invasive regenerative medicine. But if you look at all the devices that have been on the market, one, they cause a lot of pain at the surface. Two, all the energy is delivered at the skin level. It's not delivered deep into the tissue. So what Omniwave is it's a device that's been designed for portability, so people can take it wherever. It uses focused shock waves. And when I say focused shock waves, what it means is that we're reflecting these supersonic sound waves anywhere where there's injured tissue or things that we're trying to regenerate. It could be used for sexual wellness or for joints or anywhere where anybody's experiencing any pain. But these focused shock waves create micro trauma. And within minutes, people have this anti-inflammatory effect. So they're immediately out of pain. But what's more important, what's most exciting is that these focused sound waves also cause your body to start regenerating new blood vessels. And that brings in nutrients and collagen. And over a series of just a few treatments, we can heal any damaged tissue and actually grow more blood vessels and more tissues, eliminate scar tissue, microplaque, resulting in a healthier joint or a healthier sexual organ, wherever it is we're trying to regenerate. So I look at this as more of just non-invasive regenerative medicine that any practice can do for any use.
And you have been using it also for yourself, right? And people that you know. What have you seen that's been benefiting?
This morning I did a knee. Was a guy who, like, when I tell him like the benefits, he doesn't believe me. So I said, you know what, I'm going to do your knee for 3 minutes. He's had this knee for so long, he's been living in pain. Like he wasn't able to like do a squat because his knee was hurting. Within 3 minutes, he was doing amazing. So he wants to come back and get more treatments done. My daughter sprained her wrist and she had a little, what do you call it? Like a splint on. We did her wrist. Next day, she's fine. I use it on my lower back when I work out. So really, this can be used for recovery, performance enhancement, regenerative medicine, regenerative therapies. It could be used for sexual health. But what we've seen it work best for is anybody dealing with acute or chronic pain that's looking to get out of that pain or looking to increase that range of motion immediately.
So that's a great solution, an alternative from taking medications.
Yeah.
Or does it work in combination?
Oh, absolutely. I think a lot of our providers that have this device will use it with red light, PRP, exosomes, peptides, any other regenerative medicines, because it accelerates healing at a rapid pace. And the more you can combine it with other modalities, the faster it's going to work.
And from all the medical practices, all the medical I would say, verticals, where this device has been helpful the most?
It's funny because my background is working with sexual wellness practices mostly. So when we created this device a year ago, and it's made here in the US, we thought this was going to be a great device for sexual wellness practices because unlike other devices, it doesn't hurt at all. It's completely pain-free, no numbing cream, and patients can get treated in 5 to 10 minutes. But when we started placing these devices in sexual wellness practices, they were coming back to us saying, hey, most of my revenue is now coming in from people that are looking to regenerate knees and ankles. So then we started targeting regenerative practices, integrative chiropractors. We have a guy who's using it. He's a plastic surgeon in Hawaii. He uses it for scar removal. But what we're most excited about is like within the last couple months, we've been targeting people that work with athletes who want to keep these athletes on the field. So I think the biggest market for this device is going to be your sports medicine practices, your sports recovery practices, your very high-end elite training facilities that have a medical arm to it. They've been the ones who have been really reaching out to us because what they like about our device is the design for portability means teams can take it with them. Also, it's got a flex head. We call it depth flex. So you can create that focal zone using precision tooling. Other devices, you only have a fixed head. So you only go deep. Because it has a flexible head, you can treat any injury. So that's huge. But the fact that it's non-painful at all means that your patients are going to want to come back and do more treatments. So, but we've seen it in a lot of different places, but like our marketing, and I know like, I love talking to you, Alex, because I think you're a marketing guru and we've known each other for 12, 13 years. It's all about defining your niches. Ultimately, the target market of your patient is going to be everybody. Everybody, it could be an 18-year-old athlete that quarterback for a team and his wrist hurts. It could be an 80-year-old. It could be a 50-year-old. My son's 22. He plays golf. He hurts his golf. He hurts his back playing golf. He uses it. So it can be used for everybody. But I think the practices that will benefit the most are anybody dealing with active people. So when you think of longevity, wellness, concierge, anybody really, but that's the niche because when you look at similar devices out there, they're mostly targeting places that are like, when you say orthopedics, you think of people that are broken. You know, they're going in for surgery. And it does have a use case for that. And there are other similar devices that are painful, but like, in the longevity space, I think that's the niche that we're focused in.
Yeah, I'm familiar with sports medicine and orthopedic doctors. One of our clients, Dr. Shaw, and all my ex-clients, Dr. Shaw in Pembroke Pines. Mm-hmm. That's what he was doing a lot. Regenerative, PRP, athletes will come into him. It's a big market for sure.
Yeah, the athletes, like an athlete who wants to stay on the field will pay the doctor whatever it is because they don't want surgery, they don't want medicine, they want quick, rapid relief. That's not invasive, and they want to fix the root cause of what's going on.
So I can see how great. So if you are sports medicine doctor or orthopedic surgeon, you have medical practice, you have patients coming in with all kinds of stuff. That would be great. Young, old, anyone who plays sport, hey, went skiing and got hurt, that's perfect. The next vertical grade will be sexual health. They specifically will be using it for erectile dysfunction, Peyronie's disease. Then you have plastic surgeons using it for, does the device do anything for body contouring?
It does. Like if you look at the clinical studies, there are a lot of clinical studies that show that this type of therapy works well for cellulite, scar removal. It could be used for any type of skin tightening. But to your point, like the biggest use case to me is everyone, active people, guys that go skiing. Like we actually treated a guy here who hurt his shoulder skiing back in January. That was 9 months ago. He went to a physical therapist. He's tried other modalities. He still was living in that pain. He did literally 2 treatments and his shoulder pain went away. He's a very active guy, young 40-year-old guy that really doesn't really relate to, it's painful, but it's not enough where I need surgery yet. So when you think of your marketplace, think of all the guys that play pickleball on the weekends. Mm-hmm. Think of your golfers. Think of your weekend warriors, people like me that like to go running. We actually, when I first got the device, I'm thinking, okay, this is going to be great for sexual wellness. But I had been dealing with an ankle injury for almost a year, went to a podiatrist, nothing was working. I did 2 treatments and I was running again. So for your ankles, your feet, it's amazing. Knees, I've seen, there hasn't been a knee I could not fix.
Does that mean the device can be used, like, for example, in the gym?
So that's a great,
a medical person, a technician?
That's a great question. Our device is a class 1 FDA cleared device, which a lot of them are, but that gives people that are trained. So we have a certification and training program, but you don't have to be a medical practitioner to use the device. We think you need to know a lot about the human body, but it could be done by anyone.
So technically, if there is a large enough gym with a large membership, offering like say my gym lifetime, mm-hmm. have a pickleball and all kinds of other activities.
Yeah,
probably a great place to put a device there, have a technician trained, add as additional service. I think they'll also have a chiropractor in there.
So the beauty of this device is, and you and I both know, because your job is, how do I make a doctor successful? Like how do we market? And we all know marketing is not a zero-sum game. All the doctors are over there fighting on Facebook and Google for the same leads, top of the funnel leads. But the doctors that are having the most success are taking the device, going to, they're going to their CrossFit studios, their Lifetime Fitnesses. They set up a kiosk. They put a banner like this behind them. They offer a free 3-minute demo. And then they have a very simple pricing model to get them into their clinic. And once you get a guy out of pain, he'll pay you whatever to go into his clinic. So this allows a doctor or a practice owner to fill up his clinic with people that know what you have is true because he's already met you, he already trusts you, and it doesn't cost you an arm and a leg. So as far as marketing goes, this device, along with our marketing blueprint, and we've created a marketing blueprint for this device, we help providers put this into their practice, and then we help them get patients. And then when you're talking about sexual wellness, we've even developed a simple talk track. So when they're doing this 3-minute demo treatment, and they're talking about how the waves create micro trauma and grow back new blood vessels, a practice owner could mean, by the way, what we're doing on your knee, that'll work anywhere, including sexual wellness. And then the patient is now talking to the doctor about Gainswave and coming in for treatments. Obviously, you're not going to do free demos at Lifetime on penises. Yeah. But
it's a definitely great treatment to get them in, let them experience the effect. Mm-hmm. Now that creates stickiness. Mm-hmm. Now the patient is going to say, what else can you treat? What else can you do for me?
Exactly. And a lot of our practices have developed an elite regeneration program where they're taking Omniwave, combining Omniwave with red light and a PRP shot, and they're charging $3,000. Nice. And that's their elite program. And then we have a recovery program that's really just a few $100. So there's different programs that will help any practice differentiate the client. Are we dealing with chronic acute pain, or are we just dealing with a recovery? Did you just sprain your ankle while running? So
Now, will the chiropractors be great candidates to have this type of technology?
we were actually at a Chiro show a couple of weeks ago, and we have a few chiros who have it. Really, because of the price point, like I think there's a lot of confusion on what shockwave is and what shockwave isn't. So like when we started working in shockwave 10 years ago, and I think Alex, you were with me at the beginning, we thought all shockwaves were created equal. Like I could not tell you the difference. I thought, okay, this is a pistol, a bullet strikes a plate, that's shockwave. But what I've learned is that's not really shockwave. That's just mechanical energy, and it produces a subsonic sound wave that creates the cellular effects. But all of those cellular effects are done to the skin, which is fine if you're just doing a penis. But if you're trying to get deep into a hip, it's not going to work because the pain is so great and you're not going to get deep enough to fix the root cause of what's going on. But what we've learned is that if you give a practice owner the right device, it'll work. Now, going back to chiros, and what the challenge with them is, they think that, I can buy a $5,000 shockwave device off of eBay or buy a $20,000 device from even top of the line radio devices. They call it shockwave. So it's really not shockwave. It's a sound wave, but it doesn't break the speed of sound, so it doesn't create that popping noise, that shock noise. You then have to get into focus devices. So when you're talking about focused shockwaves, you're talking about physio waves, you're talking about magnetic waves. But the strongest wave you can create is a wave where you have a spark actually in water creating a plasma wave. And if you use that technology, your focal zone, so your focal zone is what you're treating. So you want a large focal zone. So that focal zone, which is what we use at Omniwave, is 3 to 5 times larger than all the other focus devices. But because of the high rise time, the patients can't feel any pain. So we have to re-educate the chiropractors, but you're also talking about technology that is $70,000, $80,000. So a lot of chiropractors, when they hear that, they're like, well, I'm used to a $10,000 device. So there's an education that goes on. But then when you show them the business model and you tie it into how this is going to grow their practice, it's a no-brainer.
Yeah, this whole thing with devices, I'm going to buy a device, but device doesn't come with patience.
No.
Marketing and support from the brand and all the marketing materials, that's where really the benefit of a device or working with the right company come.
Yeah, I mean, like my background, as you know, is marketing and sales. And because I've owned a practice for 20 years, I know that like you can sell me the world's greatest technology. But if I don't have a go-to-market plan, there's nothing, that technology is not going to help anyone. It's going to be one more piece of equipment gathering dust on the shelf with all the other pieces of equipment. So what we've done is we've created a very successful, easy to follow recipe for a practice owner to just generate revenue right away.
So Omniwave is not just a device.
Omniwave is a system. It's a turnkey business system. And it is a great device, but it's a system where we teach you how to do demos. We teach you how to set up your office. We teach you how to market it within your office. We're actually building our own version of like a marketing automation system that they can use with their marketing stuff in there. But obviously, that's what you guys do. But like once you build your pipeline, you do the free demos, those create leads that you can automate your marketing too. But it's really a simple system for any practice owner to get patients.
Very cool. So how does a medical doctor or medical practice will start with Omniwave?
So first thing they would do is once they purchase the device and they're trained on how to use the device, we have a whole checklist. So one, you want to put that device in a really good location where other people can see it. And you want to use the welcome banners, put them up. But then we've also created signs that say, got pain, try our new next gen 3-minute treatment. We train the whole staff on like a simple script like this one. Like we've made it dummy proof. We give them demo cards. So really your whole KPI when you're adding this is not like, what do I sell it at? Or how much do I price it at? Your whole business model is get people to try the machine. And then what we do is we have account managers who will help come up with bespoke customized pricing just for your practice. So we've done that. Like there was actually one we actually created. Let's see if I can get that up. I don't know if I can get that up here, but
so you guide them on, hey, you got a device, let's put it somewhere because it becomes a lead magnet. Let's put a banner so when your patients walk in the door, they can see, hey, you got something new. Let's give you some script that you can talk to existing patients while you have a consultation with them. Hey, what challenges do you have? And hey, this is a solution.
Yeah, it's everything. I'm trying to see if I can pull this up, but we give everything from pricing, business intelligence, educational. We have a whole portal for them. And then if they want to do sexual wellness, we have the GainsWave, which already has the brand recognition. So we can help a provider enter sexual wellness and then full body wellness as well. We developed, so like the sports training, I don't know how I could share the screen, but we created elite regenerative program, advanced combination therapy, where they're taking 8 Omniwave sessions, a PRP session, and 8 red light sessions and selling it for $2,500. And then we have a whole menu from recovery programs to complete regeneration programs that range from $300 to $1,500. And we'll customize that based on your market. We use AI and business intelligence to come up with like the perfect pricing model for your practice.
Very cool. So all they have to do is just treat the patients.
All they have to do is trust the system. It's like you and I both know, like practice owners want to just treat patients. They don't want to figure out new business solutions or marketing solutions. And if I give you a recipe to bake a cake and you just follow the recipe, you'll get a pretty cake. It's the same thing here. Here's the steps, follow the recipe, you'll have success.
And if you have any questions, call account manager.
If you have any questions, call the account manager and we're here to help you.
Very cool. It's like a marketing business. Account managers, here's a product or service. Let's see how you're using it. Hey, you're getting great success? Good. You don't? Let's analyze what's happening. Let's give you suggestions.
Yeah, in our account management team, we do every month we have a cadence call with them. We get them launched, and we ensure that everything's working.
That's very cool. Mark, if someone wants to reach out and have a lot of questions, what do they do? Where do they go?
So our website's omniwave.com, and they just click find a provider. And they fill out the information, and then one of our reps get in touch with them, make sure it's a good fit, go over the program, and set them up.
Become a provider. Fill information. I watched the video of one of the doctors here. It's pretty impressive.
Yeah, and the thing is, like, so Omniwave. The last time I saw you, Alex, was a year ago in Las Vegas. We were at that show as GainsWave, but we brought this device as a prototype. We had not sold a device yet at that show. We were showing it to doctors to get interest. Then we ended up selling maybe 6 or 7 devices at that show. But we didn't start delivering those devices until April because it took us, to go from prototype to production took a few months. And since that time, we've learned a lot about the market. We've learned a lot. We did a lot of business intelligence. We visited a lot of the doctors that had the device. And since then, we were able to create like this perfect business blueprint, which we are really going to be introducing. So when you see us again in Las Vegas, we're going to be there as Omniwave. We're going to just be there doing free demos, walking the doctors through the proven business methodology and getting them up, installed, and ready to treat their patients and change people's lives.
Very good. I'll stop by the booth. We're going to be in Vegas as well.
Yeah, no, it's really good, and yeah, a lot of these doctors obviously need great marketing partners because once they get the device and they want to market it, we don't do local legion, we don't build websites, we don't do any of that. So you guys have always been great partners.
Well, that's exciting. Anybody who wants to learn more about Omniwave, just head out to the website omniwave.com, click Become a Provider, fill out your information, and an account manager will contact you.